Hi guys, so now I'm going to talk about the dehydrations in pediatrics. So when the patient, there are few things that we need to look for in dehydrations, and then we need to assess the degree of the dehydration. So let me give you some example, some of the cases. Okay, 3 months old came to the hospital because of the vomiting of 10 times vomiting, as well as diarrhea 5 times a day, occurred about 3 days, and also associated with the abdominal pain. And then the patient admitted to the hospital, and the BP was thought to have was seen to have about 60 over 90, 90 over 60, and the pulse rate is about 170 beats per minute, and the respiratory rate is about 50 breath per minute. So what we need to look for the investigations, what we need to look for the patient with dehydrations. So we need to assess the degree of dehydration, whether it's mild, moderate, or severe degree of dehydrations. If it's mild dehydrations, usually the capillary refill time is less than 2 seconds. There is tachycardia, the pulse volume is good but not reduced, it's normal, and the BP probably normal, the heart rate probably tachycardia, and the mucous membrane slightly dry, and there is a slightly skin tears, and the weight for the patients probably less than 5%, 5% and below of the actual weight. So if this patient had dehydration, what we are going to do? First, we need to look for the deficits of the weight of the babies, and also the fluid requirements for the patients, either the babies or the patients. And so after we assess that, then we can do the fluid resuscitation to the patient. If there is a corrective fluid, we don't need, if there is deficit fluid, so we need to give deficits to normalize the blood pressure. We usually give 20 mils kilogram per hour, 20 mils kilogram 20 mils per kilogram, and then so this will infuse to the patient, and we look whether the BP is increasing or not. The upper limit is 60 mils per kilogram per hour. Okay, so for this we just need to give normal saline. We don't need to give dextrose, but in fluid requirement we can give dextrose as well, about 5%. Okay, so for the fluid requirements, this is based on the patient's weight. So if more than 10 kilos, first 10 kilos 100 mils per kilogram per day, and second 10 kilos, subsequent 10 kilos we give 50 mils per kilogram per day, and subsequent 10 kilos and above we give 20 mils kilogram per day. So if let's say the patient have is a 10 kilos patient, so what we did, what the fluid requirement will be, 100 times the weight of the patient. So 100 times weight, 10 kilogram, is equal to 1000 ml, 1000 mils, which is 1000 liter. 1 liter. So this is the fluid requirement, but we need to give the deficits as well. Once we have given the bolus dose to increase the blood pressure, so the deficits, how to calculate is by knowing the percentage of the dehydrations. So let's say this is the 10% of dehydrations, so 10% multiple by weight and multiple by 1000, so then is equal to 1000. Okay, so 1000 plus 1000 is equal to 2000 mils, and then you need to subtract with the subtracted it to with the IV bolus that we give. So for example 20 mils per kilogram per hour. Is it so? I'm not sure. Yeah, that's basically it lah. Okay, that's the lesson for what I've learned today. If there's anything new, I will let you know. Okay.